what I am going to discuss today is medico-legal care of survivors, victims of sexual violence. Now, why do we need to start this thing again? Because after the Nirbhaya case in 2014, Ministry of Health and Family Welfare brought out a set of guidelines and protocols with clear directives to all health facilities to ensure that all survivors of sexual violence have immediate access to comprehensive response care. These guidelines are aimed to bring about a certain degree of uniformity in approaching, treating, and documenting cases of sexual violence, mainly against women and girls. Now, before these 2014 guidelines, we were following WHO 2003 guidelines as well as 2006 guidelines about child trafficking. Now, why we needed to have this change? After a Nirbhaya case, Justice Verma Committee was formed and which gave its recommendations. There was POCSO Act which came down in 2012, which changed the definition of sexual assault, as well as the amendment of criminal law in 2013, which again changed the definition of rape with this thing that it was not only the penetrative act by the penis, but other weapons are also being included in the definition. So we needed to change the method of investigation, method of evidence collection, as well as method of treatment. So simultaneously, the ministry found that there was a lack of uniformity. There were gaps in existing provision of medico-legal care. To start with, it was only limited in most of the points as medico-legal examination. But now we have included care along with it. Better understanding of the limitations of several scientific tests. Requirement of newer forensic analytical techniques involving DNA profiling. And finding of researches carried out in respect to the detectability of the spermatozoa in genital swabs. So, and after all, why Madam Jain became so active? Because we were made aware of Honorable Supreme Court judgment on 31st October 2020, which clearly says that we have to ensure that the guidelines formulated by the Ministry of Health and Family Welfare are circulated to all government and private hospitals. This is to be followed by union government as well as the state government. Conduct workshops for health providers to communicate the appropriate procedure to be adopted while examining survivors of sexual assault and rape, and review the curriculum of medical schools with a view to ensure that two-finger test or per vaginum examination, which was initially done to see the virginity of the assaulted person as well as habitual sexuality of that person, is not a part of the procedure of examination. So as the topic consists of medico-legal care, sexual violence, assault, and what is rape, I will go in a nutshell about the definition. Sexual violence is any sexual act, attempt to obtain a sexual act, unwanted sexual comments, advances, acts to traffic or otherwise directed against a personal sexuality based on 3 points. First, using coercion, threats of harm or physical force. Second, by any person, regardless of relationship to the victim. Third, in any setting, including but not limited to home and work. Sexual assault, a form of sexual violence, is used synonymously with rape. Sexual assault includes anything from touching to sexual intercourse, as well as oral, anal, and other sexual acts, child molestation, fondling, and attempted rape. Now, rape. Incident. One thing I want to everybody to remember, that incident of rape occurred or not is a legal issue and not a medical diagnosis. Hence, on the basis of medical examination, doctor should not conclude whether rape has occurred or not. A man is said to commit to rape if he penetrates his penis, inserts any objects or a part of the body, manipulates any part of the body of a woman to any extent into the vagina, mouth, urethra, anus of a woman, or makes her to do so with him or any other person, or applies his mouth to the vagina, anus, urethra of a woman under any of the following 7 circumstances: against her will, without her consent. Thirdly, with her consent, if the consent has been obtained by putting her or any person in whom she is interested in fear of death or hurt, with her consent, when the man knows that he is not her husband, but the woman thinks that he is her husband and she believes that she is lawfully married to this man. Then again, with her consent, due to unsoundness of mind or intoxication, she is unable to understand the nature and consequences of that to which she gives consent. When unable to communicate the consent, that is language problem. However, the main point is with or without her consent when she is under 18 years of age. Now, I would like to highlight two exceptions of this. Exception one was a medical procedure intervention shall not constitute rape. Exception two, which is controversial, which was controversial, that sexual intercourse or sexual acts by a man with his own wife, the wife not being under the 15 years of age, is not rape. Means if the wife is between 15 to 18 years of age, may it be consensual or non-consensual, it is not rape if a husband has sex with his wife. But lots of deliberations, discussions, judiciary discussions, cases were there. And ultimately, Honorable Supreme Court on 11th October 2017 came with a judgment in case of writ petition 382 of 2013 that exception 2 of section 375 IPC is now to be read down as follows. Sexual intercourse or sexual acts by a man with his own wife, the wife not being under the age of 18 years, is not rape. So now we all have to remember only one line, that with or without consent, a sexual act under the age of 18 years is rape, may the girl is married or not married, irrespective. Now, who is a survivor? Survivor is a person who has agency and she is capable of taking decisions despite of being victimized, humiliated and traumatized due to assault. And victim is a person who doesn't possess an agency and is not capable of comprehending situation because of the victimhood she faced. It also means that a person is in need of compassion, care, validation and support. But nowadays we prefer to use the term survivor because we have to believe the person and not pity her. Now, what is the consent for sexual act? Unequivocal voluntary agreement when the woman by words, gestures or any form of verbal or non-verbal communication communicates willingness to participate in the specific sexual act, provided that a woman who does not physically resist to the act, it is not taken that she is consenting for the sexual activity. Then in 2012, POCSO Act came, the Protection of Children from Sexual Offences, and the main point of this law is that a child is one who is aged below 18 years, and according to POCSO Act, the sexual assault is divided into non-penetrative, penetrative and aggravated sexual act, and the punishments are decided according to the same. Now, why we are so bothered about the sexual assault examination cases? Because now after 2014, we have got legal obligations to manage such cases. As per section 164A, examination of a case of rape shall be conducted by a RMP without delay. Both private and public health professionals are obligated to provide treatment to a sexually assaulted victim. Denial of treatment may cause imprisonment for 1 year or with fine or with both. And health professionals are need to respond to comprehensively to the need of survivors. Now, how to start the process of having the setup of medical legal examination of a sexually assaulted survivor, that every hospital must have a standard operating protocol for care of sexually assaulted survivor to provide comprehensive services. This is needed to provide comprehensive services, smooth handling of cases, have uniform practices across all doctors in the hospital, and clarity of roles of each staff. The SOP must be printed and available to all staff of the hospital. The examination should be carried out in a complete privacy in a special room, having adequate space, sufficient lighting, examination table, equipment required for examination, and safety. Now, how a woman or a girl or a child can come to us? A survivor can come on her own only for treatment. with a police requisition after police complaint or with a court directive. However, whenever she comes or enters the premises of our hospital for any of the above points, a medico-legal case has to be made. The police has to be informed, irrespective of the consent of the person, whether she gives for examination or not. Now, last part is what is medico-legal care or comprehensive care. Medico-legal care consists of initial resuscitation and first aid. Any person who comes to you, you have to initially give first aid to that person. Informed consent for examination, evidence collection, police procedure and treatment. Detailed history taking, medical examination, age estimation if requested by the investigating agency, evidence collection of the as per protocol. Now, comprehensive care, documentation, packing, sealing, and handing over the collected evidence to police, treatment of injuries, testing, prophylaxis of STIs, HIV, hepatitis B, and pregnancy, psychological support and counseling, and referral for further help. Now, first aid. As per IPC Act 92, a doctor can conduct any emergency life-saving procedure without any person's consent. Same applies to a victim of sexually assaulted violence. Then name, address, age and sex to be noted. Date and time of receiving the patient in the hospital and commencement of examination is very important to note. Name of the person who brought the survivor and relationship to the accompanying person is to be noted. Two marks of identification has to be noted and left thumb impression has to be taken. Now, informed consent. Medical examination of a survivor cannot be done without or against her consent. No court or person can force a medical examination. Minimum age for giving consent is 12 years. If the child is below 12 years, parents or guardians can give the consent. If they are not available, consent can be obtained from panel of senior doctors. Whenever parents and guardians are acting against the best interest of child, especially in case of incest, like when the violence has occurred against one family by the one family member to the other family member, then child welfare committee can be taken into account. In case of mentally challenged survivor, intoxicated or drug survivor, consent can be obtained by parents, local guardian, panel of doctors, CWC or jurisdiction of court. It is important that consent should be signed by the survivor, a witness and an examining doctor. Witness can be any disinterested person, but if the survivor requires any surgical procedures or to undergo MTP, then minimum age of consent is not 12 years, it is 18 years. Consent should be sought in a language that survivor understands. Doctor must inform in detail about the purpose of examination, procedure which we are going to involve during examination. Examination may be required of mouth, breast, vagina, anus, rectum. Examination may include removing of clothes. It may require collecting evidence like scalp hair, genital swab, nail clipping, blood samples, etc. For proper documentation of written consent should be taken, explaining all the above procedures. Every person, every victim has or parents, guardians have a right to refuse full or part of the examination, and refusal of consent does not, but we should know that it is not going to affect the treatment and it should be taken it should be documented in detail. Now, step 3 is the most important part, that we have to take the history, demographic history, relevant medical and surgical history, especially vaccination history, because we may have to give prophylaxis for tetanus and hepatitis B, and the sexual violence history to be taken in detail, being sensitive to the survivor, creating an environment of trust, and do not pass any judgmental remarks about the incident. A relative could be present if the survivor consents. Record the detailed history about the details of place of assault, time, nature of force used, areas of contact, and nature of assault. Information whether victim was intoxicated or given drugs. Information on injuries, weapons used, objects used. Information of activities like bathing, urinating, washing, rinsing the mouth, drinking, eating after the assault. Whether ejaculation has occurred or not, or whether a condom was used or not. it is important that this history is to be corroborated with evidence collection. Then comes after history, medical examination. All hospitals, whether they are public or private, are mandated to carry out medical examination. There is no need to have a police requisition or a court order. Only the consent of the victim is required to conduct a medical examination. If a lady doctor is available, it's well and good. But if she is not available, then it can be conducted by a male doctor in the presence of female attendant. History taking and examination should be carried out privately, and police personnel should not be allowed either during history taking or examination. Then detail of sexual violence, whether it was penetrative or not penetrative, whether it was body part or any other object. Why we are doing this examination? Now the question comes. We have to frame an opinion, and then opinion is based on our observations and evidence collection. So what is the observation or evidence? That we have to see whether there was a sexual violence. We have to ascertain mental incapacity or mental capacity of the patient to give consent. Any evidence of medical age determination if required, and evidence to identify assailants through medical examination. How can we confirm it? By taking DNA material or samples from the victim in the form of vaginal swabs, semen, hair, semen stains and blood stains and nail clippings. So the main purpose of the examination is to collect evidence and to form the opinion, provisional as well as final, regarding the sexual act, and as well as from the point of view of examination, we are going to treat the patient. So it has to be a general physical examination with the examination of injuries all over the body. For the local examination, we can use special procedures like using toluidine blue dye, using colposcope, endoscope. In the proforma, we have got body diagrams where we can depict the injuries. But during examination, we have to be very particular that we have to collect the samples for evidence collection also. So we have to keep that thing in back of our mind. Local examination, it is very important to do examination for injuries, external genital area, vulva, injury like tear, bruises, abrasions have to be seen, any bleeding, swelling, tears to be seen, oral cavity has to be examined if the history suggests so, anal cavity and rectum is to be examined if the history suggests so. After the examination is complete, the survivor should be permitted to wash up using the toiletries and clothing provided by the hospital if her own clothing is taken as evidence. Admission should not be insisted upon unless required for observation and treatment. All services should be completely free of cost. May it be a private hospital or may it be a government hospital, services should be free of cost. A copy of all documents must be provided to the survivor free of cost. Now, age estimation is not necessary in all the cases. However, when in doubt and when reliable documentary proof of age is not there, we may need to do the age estimation, or police requests us to do the age estimation, we may require to do it. Now comes the most important part, that is evidence collection. Now, with better understanding of the limitation of several scientific tests and events post sexual violence, and also because of the changed definition of rape, we have to change certain process of evidence collection. We have to remember that absence of medical evidence does not rule out the possibility of rape/sexual assault having occurred. Standard protocol of medico-legal examination survivor of sexual assault is prepared by LNJN, National Institute of Criminology and Forensic Science, Ministry of Home Affairs. One thing I would like to say, that health is a state affair. So every state may have their own protocols regarding the examination procedure, standard protocol. But what we are following in Delhi and NCR is the evidence collection, the manual prepared by LNJN Institute of Criminology. So we will stick to the guidelines provided by them. But however, in the panel discussion, we can further clear that what is the duration of the evidence collection, because many of our panelists have attended these workshops. So the main aim of this standard protocol is to collect materials without missing any step during medico-legal examination. items for medical legal examination required is SAFE kit, that is Sexual Assault Forensic Evidence Kit, wood slam, torch, speculums, and so on. Evidence collection are of two types. One is the medical samples and second is forensic evidence collection. Medical samples are to be sent to the hospital laboratory if the facilities are available. That is blood for HIV, BDRL, HBsAg, urine test for pregnancy can be done on the spot, ultrasound for pregnancy / internal injuries, X-ray for injuries as well as X-ray for age determination. Then forensic evidence collection, we have to collect as much evidence as possible from depending upon the consent of the survivor, because survivor may consent for the part of examination or may not consent with the other part of the examination. Then depending upon the nature of sexual violence, based on the history given, whether it was penetrative, non-penetrative, penile or non-penile, orifice penetrated where vagina, anus, oral, urethra, whether ejaculation occurred or not. Then we have to have see the examination findings, time lapsed between incident of sexual violence and examination, and post-assault activities like bathing, douching, washing. So these 4 points are again very important, that our evidence collection is based on these points. Now, maximum importance these days is given on the for the collection of DNA material. Reference blood sample of the survivor should preferably be collected on a blood collection card for DNA testing. For this, we have to wipe the tip of the middle finger or ring finger with betadine swab, prick it with sterile lancet, and allow few drops of blood to fall within the circle of the card. Card is not very expensive. Presently, the card is not there in the safe kit, but we can buy it separately as the cost is not much. Dry it before packing. DNA is a crucial comparable evidence in cases of sexual violence, and as per Section 164A of CRPC, it is necessary to collect DNA evidence in all cases of sexual violence. So we are collecting DNA evidence in the form of swabs as well as smears. Evidence material should be collected in pre-labeled envelopes. The swab taken must be thoroughly air dried. Now, I would like here to highlight one thing, that in the film which we are showing to you, that we have not properly shown the process of air drying. And after the multiple analysis of collected vaginal swabs, it was found that if the swab was packed in a wet condition, then there is a putrefaction, which is then the DNA material is lost. So it is very, very, very important that all the samples collected should be air dried before putting into the envelope. The clothings, if they are also wet, should be air dried before packing. If no evidence material is collected, then on the envelope it has to be written that nothing collected. Even if a woman is menstruating, we have to collect the evidence, and we can call her 2 days after the periods again, so that evidence can further be collected. Now, details of clothing worn should be written. Describe each piece of clothing. If there are presence of stains of semen, blood, foreign material, they should be taken into swab. The survivor must be asked for the clothes if she has changed about the original clothes at the time of sexual assault, if available with her, to be collected and preserved. And body evidence from the stains, foreign material and seminal stains to be collected. Nail clippings and scrapings for DNA material to be collected. Breast swabs to be taken. And then comes the important genital and anal evidence. Pubic hair combing should be done. Loose hair should be collected. Strands of pubic hair to be taken as sample, as well as strand of scalp hair of the victim should also be taken for the sample. Vulval, urethral, vaginal, cervical swabs and slide for semen examination and DNA testing to be taken. Posterior vaginal wall washing to be collected into the syringe and sent to the forensic lab again for DNA testing. Anal and rectal swab and slide if the history is there, and oral samples are taken if there is history. Now, again, which I have discussed to you previously, the MOHF guidelines 2014 says that if a woman reports within 96 hours, then only samples to be collected for semen and DNA. If she comes after, but there may be a confusion in the history, so they say that you collect up to 96 hours. However, external body evidence and clothing can be collected for more than 96 hours. But as per as NICFS guidelines are concerned, as per their researches and as per the other research papers, they say that collection of swabs and smears can be done up to 3 weeks. Again, we will have this discussion in detail during our panel. This is the maximum reported recovery time for spermatozoa collected from body. It is in cervix, it varies from 7.5 to 19 days. So we should not lose any point or time to collect the evidence. The doctor should always dry the sample, pack, seal and label all the evidentiary materials, packets and dispatch them along with the report to the police for onward transfer to the forensic lab. Products of conception are collected for doing DNA profiling and should be handed over as early as possible. If not possible, they should be stored in 4 degrees centigrade after washing with saline and a plane of transfer to be maintained. Now comes the provisional clinical opinion. So our main purpose is to, after examination and evidence collection, to form a provisional clinical opinion, and it should be done as early as possible, and it should in brief mention relevant aspects of the history of sexual violence, clinical findings and samples which are sent for hospital as well as analysis to FSL. An inference must be drawn in the opinion correlating the history and the clinical findings. So clinical findings, whether genital and physical injuries are present. If both are present, suggestive of forceful penetration. Only genital injuries are present, suggestive of forceful penetration. Or only physical injuries are present, suggestive of use of force. However, penetration or insertion cannot be ruled out. Or neither genital nor physical injuries are present, suggestive of no use of force. However, sexual assault cannot be ruled out because the victim might have been drugged or intoxicated. We have to give complete sign and signatures and all the details. Then comes the opinion about the age, whether there is collecting the physical, dental and radiological examination about the age estimation of the victim. And then comes the final opinion. It is to be given only once we receive the report from the FSL labs and the findings are written, that these reports bearing identification mark, I am of the opinion that sexual assault occurred or not occurred, or depending upon the DNA matching report, we can add further comments. Copy of the entire medical report at the time of examination should be given to the survivor / victim free of cost and immediately. The copy should also be given to the police personnel. Now, what are the limitations of all the examination or evidence collection? That it should always be kept in mind that normal examination findings neither refute nor confirm the forceful sexual intercourse. Hence, circumstantial and other evidences may please be taken into consideration. Absence of injuries or negative laboratory results may be due to inability of survivor to offer resistance or delay in reporting for examination or other activities such as urinating, washing and so on. The reasoning must be mentioned while formulating the opinion. Then comes the collection, packaging and forwarding. It is the responsibility of the doctor who have examined to make the proper arrangement for forwarding it to FSL. All blood samples must be refrigerated until handed over to next in chain of custody. The hospital must, this again comes under SOP. The hospital must designate certain staff responsible for handling evidence, and no one other than these persons must have access to the samples. This is done to prevent mishandling and tampering. If a foolproof chain of custody is not maintained, the evidence can be rendered inadmissible in the court of law. A log of handing over of evidence from one custodian to the other must be maintained and should be properly mentioned in the standard operating protocols. Now comes the treatment guidelines. We have, as I've said, that we have to draw blood for HBs AG and if possible, administer 0.06 ml per kg of hepatitis B immune globulin immediately, anytime up to 72 hours. Emergency contraception can be given to the patient. Pregnancy test can be done to know whether she is already pregnant or not. And if there is any evidence of STIs, then we have to give treatment for the STIs as per the routine protocol. Laceration to be cleaned with antiseptic or soap and water. Injection tetanus toxoid to be given of the patient to the patient if survivor, if not already immunized. Post-exposure prophylaxis for HIV should be given if there is a history of high-risk behavior and if the patient reports within 72 hours. And very important part is follow-up. Emphasize the importance of follow-up. It is ideal to call for re-examination after 2 days after the assault to note the development of bruises which might not have been present at the time of fresh injury. And also all follow-ups to be documented. A repeat pregnancy test can be done and patient is asked to report if she misses her period. Repeat test for gonorrhea if possible. Repeat after 6 weeks test for VDRL. And we also have to assess the psychological sequelae and reiterate the need for psychological support. Psychosocial care to be provided to the patients. All survivors should be provided the first line support. This is a very important part of medico-legal care mentioned in 2014 guidelines. We have to see that patient is given proper psychological care and she is able to support herself to ensure that there is someone also to train at the facility to provide her this. This is again the flow chart: first aid, consent, case particulars, then examination. Examination may be of age estimation, then examination may be for examination followed by collection of medical samples, collection of forensic samples, then documentation is done, then dry sample, pack and seal the samples, hand over to the police with chain of custody from the doctor who has done the examination, then treatment of injuries, STIs, emergency contraception, discharge, and follow-up. So this was the all. Now just the points to remember. Incident of rape occurred is not a legal issue and not a medical diagnosis. Hence, on the basis of medical examination, doctor should not conclude whether rape has occurred or not. Informed consent is mandatory. Information to police is mandatory. Whether patient wants it or not, it has to be a MLC. Per vaginum, per speculum examination should not be done unless required for detection of injuries or for medical treatment. Previous sexual experience or habituation to anal or vaginal intercourse should not be asked in detail by the victim. Two-finger test neither to be conducted nor to be commented upon. Injury documentation is must. The nature of forensic evidence collected will depend upon the three main factors: nature of sexual violence, time left between incident of sexual violence and examination, and third, whether survivor has bathed or washed herself after the assault. Age estimation is not mandatory, but if asked to be done. Medico-legal examination report is prepared in triplicate: one original for investigation officer, second copy for survivor, and third for hospital record. Opinion drafting should be done immediately. Forensic evidence collection should be done as far as possible, and maximum number of samples to be collected, which are taken according to the history and the examination. Thank you.